I do know a few things that we are concerned about. As you mentioned, the Medicaid cuts, and what that means, and what that means for states. Are we able to take our reserves and our funding to try to fill that gap, or do we end up with people that aren't going to be a part of Medicaid anymore? In addition to that, as you know, the Affordable Care Act, there's some subsidies that help to ensure the premiums are lower. So, for example, I know you have insurance probably through the university, but if you didn't, once you graduate, you could go through the exchange, and then based on income and those kind of things, you get subsidies to help you pay for your premium. And so those subsidies are going away, so you'll see those premiums really hike, and so that's going to really impact Florida. And you know, depending on where you are on the political scale, people talk about, you know, healthcare not being a right, or healthcare being a human right. Doesn't matter where you are in that. One thing I can tell you though is, regardless, we're all paying for it no matter what. And so, for example, you can't go, let's say you don't have insurance and you're sick, the hospital has to treat you. For them to receive federal dollars and have their nonprofit status and to be able to get federal dollars like Medicaid dollars, they're required. If you have, I don't know, someone ran over you with a car, you cannot have insurance. They've got to stabilize you and treat you. Well, that's going to cost money. And so even if you had, I don't know, a very severe diabetes, and let's say you haven't been taking or you don't take medicine, you never see the doctor, now it gets so bad you have to have your leg cut off or something. They'll do the amputation, but once again, they're doing that completely for free. And so when people say, hey, you know, healthcare is important, but who's going to pay for it? We're paying for it anyway. So the question becomes, how do we have a system that lowers overall cost, increases quality, and the Affordable Care Act helps do that?